Hello, thank you for joining us. My name is Tom Alves. I'm the Head of Development at AHURI, and it's my pleasure to welcome you to this webinar today. To begin, let me start by acknowledging the traditional custodians of country throughout our nation. I want to pay my respects in particular to the people of the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past and present. And AHURI acknowledges the Aboriginal and Torres Strait Islander peoples across the country and their connections to land, sea and community. And we pay our respects to their cultural, spiritual and educational practices and elders past and present. And I also want to acknowledge Aboriginal and Torres Strait Islander people who are joining us for this webinar today as well. For those of you who don't know us, AHURI is a national organisation. We are dedicated to housing, homelessness and urban research. And through our national network of university partners, you can see our university partners at the bottom of the screen there, we undertake research that supports policy development for all levels of government, that also assists industry in improving their practices and informs the broader community. And on that note, I just want to take this moment to acknowledge, of course, that we had a great policy development in the budget last night with $60 million allocated to supporting community housing providers and enabling them to provide housing for this group of people, children and young people experiencing or at risk of homelessness. So that's a great win. And I'm actually going to look down the barrel of the camera and address those people who've played a role in making this happen and campaigning and providing the evidence for this over quite a long time. Yeah, thank you. Well done. That's a really great win. And it's going to be a great support for the people who find themselves experiencing homelessness at this particular age. So thank you. But back to the webinar, the chat function for participation can be found on the right-hand side of the screen. You can use this chat to communicate with one another during the webinar, to share your thoughts and comments. You may wish, for example, to let us know which particular country you're joining us from as a way of jumping in and breaking the ice. And we also have a Q&A function as well, and you can use that to put in your information. I'll give you a bit more information about that in a minute. All right, in addition to the research that we publish at AHURI, we also organise and run events like this webinar, but each year we run a major conference, and coming up this year is the Australian Homelessness Conference, which is at the Darwin Convention Centre on the 7th and 8th of October. This year. Early bird registration is open for that, and the program is now available if you want to go to that website and have a look. I encourage you to do that. All right, so before I introduce our speakers, I just want to say that we'll be talking about better futures, supported accommodation for unaccompanied children and young people experiencing homelessness. This webinar is building on the report that has just been released, which the lead author, Catherine Robinson, is joining us here today. And it's available on the AHURI website. It's also available today in this webinar through the handouts part of the webinar on the right-hand side of the screen if you want to jump there directly while the webinar is going on. But for the rest of you, please do go to the AHURI website and download the report and have a read of that. The webinar is being recorded, and it will also be available through the AHURI website subsequent to this event, so you can go back and listen again or share it with others should you wish to do that. All right, on to the webinar itself. Our presenter today is Associate Professor Catherine Robinson. Catherine, welcome. Catherine is from the University of Tasmania. She's the lead author of the report that we're discussing today, and she's done that report with others from the University of Tasmania and also Swinburne University. And I'll let Catherine say when the time comes, but obviously this is research is a team sport, and we want to acknowledge those other researchers who've been part of the work as well. And then I'd also like to welcome two other people to our webinar today. One of those is Jane Gaetani-Black. You can give us a quick wave, Jane. And then also Sharon Gough. Jane Gaetani-Black is the CEO of Karinya Youth Services, which operates in northern Tasmania, in particular serving young women, but not only. And Sharon Gough is the CEO of Indigo Junction, which operates in Boorloo, Perth, in the northern part of that city, and provides services and support to particularly Aboriginal young people. Again, not exclusively, I don't think, but we look forward to speaking with both of you further after the webinar, and I might be asking you a bit more about the budget announcement, as well as asking some of the questions that have come in from our participants today. So we shall move on now. All of our presenters have their bios available, which you can look at later on if you go to the webinar website. Today's webinar runs for 1 hour. We'll be finishing very promptly at 1 o'clock. And I'll start by introducing Catherine and getting her to come on and present her research, but then after that we'll be joined by Jane and Sharon as part of a panel discussion. So Catherine, welcome. I'm handing over to you now to take us through your research. Thank you.
Thanks a lot, and good afternoon, everybody. I am just, sorry, getting the slides right, first of all, Tom. So look, thank you everyone for being here today. It's great to be able to connect with so many people nationally. I'm presenting today from the unceded lands of the Muwinina people of Lutruwita, Tasmania, and I extend my gratitude to the Tasmanian Aboriginal community for their continuing custodianship of lands, skies, seas and waterways. I also want to acknowledge those with a lived experience of unaccompanied child and youth homelessness joining today. I really hope you find resonance, respect and value in the discussion. As I'll explain shortly, the voices of young people experiencing homelessness are central in this report, as are those of the practitioners working alongside them. So again, thank you to Tom and the whole AHURI team in the background for hosting this webinar. And speaking of teams, what a cracker group of research colleagues I had to work with on this project. We proposed this project exactly 3 years ago in 2023. The commitment to delivering a project of national significance from a limited budget over this extended time frame, and the commitment to engaging in in-depth fieldwork with young people and practitioners is no small feat, particularly during a period of such strain and uncertainty in the university sector. So thank you, Carmel, Deb, Wendy and Joel. It's been a privilege to work with you. And today I present this work on everybody's behalf. What I'm talking about today is our research exploring better care and better futures for unaccompanied children and young people aged 12 to 24 experiencing homelessness. While supported accommodation is just one element of needed holistic responses in both preventing and responding well to experiences of homelessness, it's a crucial one. And for unaccompanied children and young people, it's especially crucial, as of course, these are humans who occupy a specific developmental and social location, which means their capacity to access independent forms of support and shelter is extremely limited. In this research, funded by AHURI and supported in kind by UTAS and Swinburne, we set out to explore what unaccompanied children and young people need and want from supported accommodation services, whether they're able to access this, and what an ideal supported accommodation service, what shape an ideal supported accommodation service continuum should take. We engaged with young people and practitioners currently living and working in diverse supported accommodation services, and were guided by a national practitioner advisory group comprised of senior practice leaders across every state and territory in Australia. We also had input from members of the Y Foundation's Youth Homelessness Representative Council, who provided critical lived expertise review of our findings and their own input into how an ideal supported accommodation system should be shaped. In metro and regional areas of Tasmania and Victoria, and in different types of supported accommodation services, we sat down in dining rooms with over 50 young participants. Over many boxes of pizza, we talked in depth about young participants' experiences of supported accommodation, the extent to which services meet their needs, and how they would like to see both individual services and the broader supported accommodation services system reformed and strengthened. We also made a custom request to the Australian Institute of Health and Welfare for data better reflecting current contact with the specialist homeless service system by unaccompanied children and young people aged 12 to 24. This request brought to a head previous sustained advocacy for better visibility of unaccompanied homeless children in particular, and for age cohort data breakdowns, which more usefully reflect current policy settings and service operations in the child and youth homelessness sector. As a result, this data is now going to be routinely reported. And we can now provide an update today on the last financial year. This was very kindly prepared by Deb Batterham just yesterday. And this is where this project really starts to bite. Over 40,000 unaccompanied children and young people presented to specialist homeless services in the last financial year, a significant 14% of the total population using SHS services. Nationally, nearly 11,000 unaccompanied children. And remember, these figures only reflect the scope of contact with the specialist homeless service system, not the actual scale of homelessness being experienced by these cohorts in general. What both further SHS data analysis and group interviews illustrated is that along with the large scale of need for supported accommodation, unaccompanied children and young people experience a complexity of needs for care within services, as you'd expect for children and young people aged 12 to 24, and in particular for those continuing to survive lifetime adversity and trauma. What young participants and practitioners so clearly described, however, is a current system of supported accommodation routinely unmatched to what children and young people need and want. In a nutshell, they reported big holes in our supported accommodation offerings, holes which in themselves generate workplace trauma for practitioners and entrench children and young people in short-term services not adequately staffed to provide the intensity of care they need for the time frame they need it. This is what we describe in the report as a situation of care conditionality. Some care is offered, but not enough. Enough to ensure survival for most, but not all. Enough for some to survive, but not necessarily to thrive. Loud and clear, what we heard is that enduring relationships of care are crucial to children and young people. Of course, we know this from growing up ourselves and from tending to the children and young people in our own lives. We don't conditionally love and care for our own kids for an arbitrary 3 or 6 or 12 or even 24 months at a time. Young participants described the hurt and terror of conditional care that they received, of knowing their care time was limited. And practitioners described the moral injury of having to turn away children because their staff to client ratios, such as 1 worker to 8 or 9 kids, or their eligibility criteria of 15 years plus, meant some children and young people were deemed to present too much risk or were too young, when in fact it's adult systems that offer them too little and systemically produce these service exclusions. In summary, the more children and young people needed care, the more likely it was that they could not access it. Along with building out the scope of practice through targeted training, clinical governance, and making a 2-worker staffing model mandatory, extending service duration to match developmental need was identified as key. This is about enabling deep and stable relationships of care to take root, and also about simply recognising that kids need time to grow up strong and supported, and that this can take longer than our current service system will commonly give them, calibrated as it is on historically outdated notions of past quick transitions to independence. Young participants also made other sharp observations that should really pull the sector up. For example, too many said that when they first became homeless, they had absolutely no idea that child and youth homelessness services even existed. This should tell us that knowledge of services that seem so obvious to us no longer makes its way into kids and young people's lives. What is the contemporary communications reach of our services, especially when these services might be buried within larger adult serving organisations that might deliver anything from aged care to gambling support to parent groups? 2 key system responses commonly noted as needed were supported accommodation for unaccompanied children and low barrier, medium-term and transitional accommodation for those experiencing unmet high support needs, in particular in the context of complex trauma and mental ill health, including self-harm and suicidality. And for those exiting transitional supported accommodation, housing stabilisation was seen as a key offering that would help open up diverse longer-term housing options. For example, with chosen family, with friends and with safe adults. Having intensive outreach support to ensure new housing options remain held in place was seen as a key cost-effective mechanism to keep freeing up transitional options and to help young people weave the family, neighbourhood and community networks that will ultimately help them flourish into older age. Young participants also offered some observations about the at times brutal institutional physical design of existing supported accommodation services. And they offered a real challenge to adult concepts of these as workplaces, as stopovers in children and young people's lives that they shouldn't really attach to. And yet attachment is precisely what young participants said they craved. Attachment to homely places, people and animals, ideally actively supported by clear service orientations and well-managed connections to other residents, and the ability to nurture house pets, both in shared living facilities and in independent transitional units. Importantly, what young participants and practitioners emphasised in this research is that filling these key system gaps would make it more possible to enter straight into the supported accommodation option actually matched to the intensity and duration of their care needs. The idea that a child or young person's first system contact has to be with a crisis service is a red flag that a robust, intentional continuum of supports is not on the table, and that early system contact for assessment is limited. Consistently, access to low barrier supported accommodation emerged as the critical missing piece, with its absence in supported accommodation systems trapping young people in endless cycles of crisis and medium-term accommodation, as they are neither able to enter nor sustain private or public rental, nor access high barrier foyer options, and nor return home. It was also described that in most states and territories, an unaccompanied child is forced to couch surf or worse before aging into crisis accommodation. And yet we know that experiencing homelessness before 16 is a key predictor of both youth and adult homelessness. We heard the repeated call: meet unaccompanied children early with age and developmentally appropriate services. Meet young people with complex unmet needs with the dignified, extended care they need. And disrupt the system harm and moral injury that comes with service rejection and forced flight paths of cumulative trauma. We now have time to circle back over some of these key issues and to also hear from Sharon and Jane about how they have sought to bridge some of the glaring gaps in the supported accommodation continuums in Western Australia and Tasmania. But I hope my brief overview has given you a flavour of the report. I'm just going to leave you with this high-level policy and practice shopping list, none of which is rocket science, but hopefully is a clear-eyed view of where you land if you think about holding unaccompanied children and young people at the centre of system design and reform. Include kids and young people in design work. They know what they need, and they certainly know what it's like to be rejected from existing services. Design and resource legal child and youth safe organisations with a mandatory two-worker staffing model. Design and resource low barrier, unconditional, medium-term and transitional supported accommodation services. Let's change the message to young people that they are too hard and too much, and reflect instead on how what we are providing is too little. And let's lead across state and territory borders with a national vision of supported accommodation systems aligned to developmental need and to the challenges of youth transitions in contemporary Australian society. What a great time to be having these conversations, as 3 states and territories now work to implement their own child and youth homelessness strategies or action plans. And of course, as Tom mentioned, with the very recent announcement that discrimination against young people in the social housing sector might finally be reduced. It's surely time to bind this good work together at the national level to help showcase what the fullest care continuum of supported accommodation and youth housing should look like. And in the meantime, it's the young voices in this work that will already guide us to better futures. Thank you.
Wonderful. Thank you so much, Catherine. We really appreciate that overview of your research and what it found. And it's great to have 2 wonderful people who are very much involved in delivering the solutions that you talked about to join us now as part of our panel discussion. We're starting to get some questions come in the Q&A. So please, if you have a question, put it in there and I will attempt to ask as many as I can. We also had a number of you send in your questions ahead of the webinar, and we appreciate that very much. And I'll be working through those as well. Apologies in advance if I don't get to cover off on all of the questions, but we'll jump in right now. And in fact, Catherine, one of the questions we got was around how the voices of the children and young people were included in the research. And I think we've heard from your presentation quite clearly how that happened. So I won't take that any further, but we'll go now to, I guess, Sharon and Jane and bring you into the conversation. And just to remind our the people online who joined us, Sharon is the CEO of Indigo Junction in northern Boorloo, Perth, and Jane is the CEO of Karinya Youth Services in northern Tasmania. So two different locations, but working with this wonderful group of young people in each of those places. So I might just go quickly first to you, Sharon, and just say, look, how many people are you working with, and can you just tell us a little bit about who those people are?
As you touched on, we're in Wajak Noongar Butcher. This community in the 2022 census had the highest percentage of homelessness within the state. And we also have within our local government area the highest number of Aboriginal people in Western Australia. A huge proportion of those are Aboriginal young people. We obviously deliver youth accommodation services, so we see a lot of that youth community come through into our services. I guess around 2015 we started to really note trends around unaccompanied children coming in through those services, and to Catherine's point, those with complex need. So probably around that time we started to really reflect on I guess our service contracts and the way that we were delivering services, because it essentially wasn't meeting the needs of that cohort. Basically, a lot of the young people we might see were not welcome in other services, in that their behaviour was complex in relation to kind of AAD, misuse and trauma, and their behaviour was exceptionally challenging. So that posed obviously risk to staff, other young people within our accommodation services. Around that time, I travelled internationally, and also that kind of aligned with some reform around the WA homelessness strategy, being underpinned by Housing First principles. So our work really started to reflect that practice and that work, and we noticed, I guess, significant success in working with that client group. Also, I guess, just in relation to the service contracts, back in that day, we would have a 3-month time limitation, and we were expected to move young people into our service and out of our service. All of those dated practices were not working. So we worked really in close collaboration with state government around modifying our service model to actually meet what the needs of young people needed. So I guess essentially our practice was based around Housing First for youth back in that day, without having, I guess, the resources to kind of match that way of working. And yeah, I guess for those of you that don't understand what that way of working might look like, but essentially it was kind of providing housing and accommodation without any kind of condition or expectation around behaviour for young people, and no time limit to that way of working either. Really relationship based, and really working with young people to address healing and trauma in a really culturally sensitive way as well. So very recently we've been kind of progressed that work over a lengthy period of time, and have very recently just been notified by state government that they're going to fund a model in Western Australia, which is fantastic. We've also built a purpose-built facility which has been designed in collaboration with young people that we serve and support, and trauma-informed design principles. So things are progressing in WA.
That's fantastic, Sharon. And Jane, if I can just ask you, roughly how many young people are you working with in your service, and what kinds of support are you offering?
We work with approximately 80 young people at any given time in the organisation. And last year we provided about 18,500 bed nights for the last financial year. Our core business, we've been going for about 50 years now, and our core business is crisis accommodation for young women aged 13 to 20. And from our core business over time, we have grown to we're now providing a young mums program. It's Karinya Young Mums, or KIM. KIM has grown in response to young pregnant women in crisis accommodation services having nowhere to go to because we're confined to a 13 to 20 year age bracket, but we don't take children. So young pregnant girls really had nowhere else to go to across northern Tasmania. So KIM came about, addressed a gap in services, and it provides accommodation and intensive wraparound support in the community. Once again, relational based, it's place based, and the wraparound support is based on what the young mums are telling us that they need.
So does that include things like, primary health care, AOD support, mental health as well? Like what kinds of things are we talking about?
For sure. I mean, the accommodation is a requirement because because of the homelessness factor and that instability to be able to build on providing the support that they need. So we will tap in. We get young mums into the program at 12 weeks gestation. And so we support them through antenatal processes with acute care services, and we also support them through postnatal services as well, hook them into child health nurses, GP appointments. So we're sort of that primary, helping them to access primary health services. So similarly, what we noticed within our crisis services, there was another gap in terms of exit options for our young women, particularly for the under 16 years of age. And that's we have a boys' shelter or a shelter for young men very close to where we are in Launceston, and so they were having similar obstacles as well. And so what we did is we knew that we needed to develop something in terms of transitional capacity for young people, because many of our young people weren't eligible for youth foyers or the Education First model, and they also weren't eligible for youth to independence in terms of shared houses and pods. And many of them really struggled to share living arrangements as well, particularly if they've come from overcrowded homes. So we developed a pilot called Karinya Youth Transitional Tenancy. It was funded by the Tasmanian Community Fund. It's a 3-year pilot. The model was based on the Housing First for Youth principles. There were some conditions, obviously, for the pilot in that we weren't able to offer long-term housing in the program, and the young people needed to engage with us as well so that we could get the evidence through an evaluation that Catherine supported us with to be able to influence government policy around recognising that there is an unmet need for complex, high-end needs young people in the community. So we're in the last 5 months of the pilot now. We take people from the youth justice system, we take young people from failed out-of-home care, placements from crisis accommodation as well. And what we have been able to demonstrate is that when it's relationship based, when it's youth led, that the impact is significant. All of our people are demonstrating improvements in health and well-being. They're all reporting an improved feeling of safety through stability. They're sleeping better. They feel like they're in control. There's dignity, and they're developing confidence. So they're moving out of survival mode and thinking more about their future. 80% of them have re-engaged with education and employment, which is, another achievement that we're really proud of in terms of this group have generally disconnected from education at a very early age. And so having the confidence to reconnect with education and employment has been really useful.
That's great,
Jane. In a position where we're lobbying for funding to keep the program going.
Great. And Sharon, if I can come back to you, you mentioned, and we know that you provide service in particular to Aboriginal young people. There's a question here regarding, I guess, the cultural safety and how that is achieved in these programs. Can you maybe tell us a little bit more detail about how you, what things you put in place? What are the sort of ingredients, if you like, in your service that help to make it culturally safe?
Certainly. We work really closely with the local Aboriginal community. Probably 40% of the staff that are engaged in employment with Indigo come from Aboriginal backgrounds. And then I guess essentially we also have a cultural committee. So we don't design anything, whether it's a program, a building, anything, without everything going through that cultural committee. The cultural committee is made up of people, elders from the local community, but also people with lived experience and also staff. Obviously that's a separate, there's no cultural load opposed to people that are, kind of engaged with employment at Indigo. That's a separate piece of work. And then we've also been supporting the local community in collaboration to develop an Aboriginal community controlled organisation. So that work is ongoing. There's a range of different touch points in terms of cultural safety, but it's, at the forefront of what we're planning and thinking.
Yeah, thanks, Sharon. And you mentioned too, Sharon, that you had some sort of international engagement before you opened that service. And were there particular things that you saw overseas that were of interest?
Certainly. I guess what was predominantly of interest was the homelessness service system and approach in Calgary, in Canada. That was around the time that our 10-year strategy was being developed, which has clearly been underpinned by the framework and the ways of working within Canada. Certainly there was, just in terms of the way that the service system worked together around making sure that the young people that we're talking about today didn't fall through the gaps, and also about the way that the service system was resourced and understood. We were exposed to a system that understood that we needed a diverse range of options to match young people to, rather than this kind of block, system approach around and programs that were all the same. Clearly, it's important that organisations work to their strengths. Some organisations have a higher risk appetite than others, and really, young people need a diverse range of options. We need a system that has foyers, so we can keep everybody safe, but we also need a system that provides that rather intensive support that might be required for the young people we're talking about. To Catherine's point, you can't do that with the state, same kind of service methodology or staffing ratio. It needs to be, considered differently.
And Catherine, I might bring you in here. We've had a couple of questions around what are the best practices and what is the gold standard for providing services to unaccompanied children and young people. In your sort of, review of literature and of different practices around Australia and also internationally, what would you, sort of classify as best practice or better practice? What are some of the interesting and good things that you've seen?
Thanks, Tom. And I think my answer answers quite a few of the questions that are popping up in the chat. Because really, if you provide an intensity of care that is resourced with enough staff and that can hold young people for an extended period of time. Most of what children and young people present to services as unmet need can be resolved, whether they're transferring out of the out-of-home care sector or the youth justice sector, or coming in from rough sleeping. So over and over again, it is the duration of care on offer and the skills and capacity of staff to hold a higher risk load, to work with a broader scope of practice, but be resourced and trained to be able to do that. So not hanging staff out to dry with high risk children and young people without the resources to safely care for them. And look, it has to be said that just the key gap that kept coming up in the work that I did locally, and that is really, I think, front and centre, as Sharon has said, in work in Canada, is the Housing First for Youth model, which tries to pick up on those core elements of what would it look like if our care for young people was unconditional rather than conditional. What would it look like if we built services that didn't have to reject young people who most need the kind of intense care that we should be able to offer? So, yeah, I think Housing First for Youth is a clear gap in most supported accommodation service continuums in most states and territories in Australia. Obviously, Indigo Junction and Karinya are trying to step into that gap. And then at the other end of the spectrum, there are clear gaps around unaccompanied child homelessness and the need to have developmentally appropriate care that might be a mix of both outreach and accommodation. And missing there is a real piece around family reunification and family therapy skills in our practitioners working in the child and youth homelessness system to be able to actually deliver on that. Hopefully that goes some way to answering that question, Tom.
Yeah, thank you. And there's been a couple of questions, particularly around the younger end of this age cohort, children who are, maybe 16 or perhaps even a bit younger than that. And there were a couple of questions in our before the webinar around, relating with particularly child protection and relevant government departments and agencies dealing with children. Can I get maybe Jane and Sharon, both of you, to reflect on what that has meant for you, particularly that interface with the government agencies, whether you've needed to advocate for particular changes in how things are done?
Do you want me to go?
Yeah, you go first, Sharon. Great.
Right. I guess essentially young people connected to child protection or should have been connected to child protection were a key cohort in terms of the young people we're referring to. Probably around 2015-16, to address that, we formalised a partnership with child protection to try and avoid, young people exiting the child protection system, because that's what was happening, and exiting that system into homelessness. So we partnered with the Housing Authority, which is the Department of Housing and Works now in WA, and Child Protection around, a partnership that applied Housing First to try and avoid that. That's not to say that we're able to accommodate every single referral that comes through, because, while these responses are, certainly having an impact and making a difference, I think it's fair to say that the demand for the supports, particularly around youth accommodation, far exceed any of our capacity to respond. I think just very recently there was some data through the Youth Homelessness Coalition that's been initiated in WA that there's as many as 800 young people each night and probably 3 beds available. Like what we're talking about is not increasing beds, but just to get a scale of the severity of the problem. But yeah, we partnered directly with those other government departments to try and I guess, mitigate young people leaving care straight into homelessness, because the numbers were astronomical.
Yeah, thanks. And Jane, there's a specific question too about your KIM program and whether that required any, particular to support the investment for that. Did that require any sort of policy or legislative change?
No, look, it didn't at the time. We initially started. We received some philanthropic funding to actually get the program off the ground, and then an evaluation was undertaken of the program, the cost benefit analysis, socioeconomic benefits, the benefits to the mothers and children who were in the program. So we started off in the philanthropic space, and then we were picked up by government. Because we worked with high-risk young people, and we were providing accommodation and the wraparound support, and we were getting some stability. We now are in a position where we are government funded.
Right. Okay. Yeah. Great. And there's also a particular question there for you if you're dealing with many people who are leaving out of home care, Jane.
We are looking. Sharon mentioned about children who are known to child protections or children who should be known, because we work. Our child protection services work in a high demand area, and they're continually looking for options to be able to support families or support a young person who is at risk. And we know, we all know that there are failed placements or placements in out-of-home care, and before the young person is necessarily mature enough or capable enough to live independently. I wouldn't be able to put my finger on exactly how many, but certainly young people from the youth justice system and young people transitioning from out-of-home care are the main cohorts within our KITE program.
Right. Okay. And is that the same for you too, Sharon?
Yeah, that would stand to reason. That's correct. Exactly.
Yeah. Great. A couple of questions around, I guess, how you've involved young people in co-design of your services, and you both mentioned that, I think, and particularly around the design, design of services, and programs, but also design of the facilities, the temporary accommodation that you've built as well. Can you just talk a little bit about what that involved, and how did you make that a kind of more genuine engagement, not just a tokenistic process, but something that was really sort of brought insight to the table? Yeah, Sharon, you can kick off on that. Thanks.
I guess it really aligns with our ways of working across all of the community that we support. But for the youth accommodation, the new build, we brought young people back with lived experience that have been through our services over the last 10 years through a number of different workshops. They had some aspirational goals around what the building should have, from swimming pools to all kinds of things that were not achievable, but really listened deeply around what it was that they did need, like what the place should feel like, smell like, sound like. Had some incredible insights in terms of the shape that it's taken. So yeah, but that just aligns with the way that Indigo would be working. So that was over a series of different workshops that occurred. But at every step, like I said, of the process, we're not making decisions on behalf of the community we support. We're bringing them into those decisions.
I guess from our perspective, our young people informing, certainly the KITE program in particular, we had conversations with young people while they were in crisis accommodation about what would they need moving forward if they weren't able to reconnect with their family again. So that was the basis for us actually considering what the level of support might be required in the community, what the skill set that we would need of the workers to be able to do that as well. And so we also had a young person who actually came, who had a history of homelessness, lived sleeping rough in a local park, who actually came with us to speak of her experience when we were doing a pitch to the Tasmanian Community Fund to get the pilot up and running. So, and we've also, we've fine-tuned the pilot in terms of as young people's input, what's working for them, what's not working for them, and, appointments didn't work for them. So, we have a highly flexible model that has very experienced staff, but the level of support provided is the level of support needed by the young person. So that's something that has very much shaped our service, because it's very difficult to demonstrate what intensive support actually is and what it looks like. It's not just 1 hour per week or 1 hour a fortnight. It might look like daily support until such times as they are starting to develop some confidence, or they're feeling like they're comfortable in their property. And so, and sometimes the level of support tapers off after a little while if they're having a period of stability. But then once again, if they are demonstrating to us that there's something wrong and they need more support, they know that we don't offer a time limit. It's what they need.
Great, and that might be a nice, segue. You mentioned of time limits there. While you do that, this is homelessness support. These are temporary accommodation, emergency accommodation options. I just want to ask a bit about, what happens next for these people, and how they exit from your services. What's sort of there to enable that transition into something more permanent. And it's also, a good opportunity to, reflect on the budget announcement last night and how that might have an impact on things as well. Again, Catherine, I might just go to you and just say if you, based on what was announced in the budget last night, if you've got some thoughts around how that might impact people living in temporary accommodation that's specific for young people.
Yeah, look, I think obviously it's an incredible win and a really sort of exciting moment in terms of thinking about how we start to think more intentionally about supported accommodation service and youth housing design, and what that full arc of service provision can now look like, because we actually are starting to see this possibility of more permanent exits being possible through the youth housing penalty being addressed. So what I'd expect the impact of that to be is that in the transitional space, which might be where you see youth foyers and ideally housing first for youth alongside youth foyers existing, that now with increased access to social housing options for young people, there might be increased flow on. Remembering though that key to that is also having that transitional space be really strong on providing unconditional services as well. Otherwise, children and young people will remain locked in crisis and medium-term accommodation and have accumulated long trajectories of harm before they can even look at the possibility of entering into the social housing space, which will still, I'm assuming, work on a basis of priority and also on a basis of matching. And my fear is that, again, we could see the rejection of young people with more complex needs. And so that's something to really keep an eye on as we continue to kind of build out our complete accommodation continuums.
Yeah, thanks, Catherine. Sharon, what are your thoughts on that? Are you, do you see your young people that you have in your service, struggling to find accommodation from there? Like what's the
Yeah, most certainly. So the system is, essentially at a gridlock. Obviously, we're all experiencing an affordable housing crisis, but for young people, they're at a particular disadvantage. So to your point, congratulations to the Home Time campaign. We're a community housing provider, and it has been a barrier in terms of securing young people options post our support. But certainly it may also be that there's, to Catherine's point, the need for that to follow some young people. Certainly we're talking about the numbers. It'd be great to open up some of the spaces. We quite often will have young people within a setting for 2 to 3 years. To have a continuum of housing options is obviously well received.
Great. And Jane, look, I think the last word's for you. We're going to have to wrap up our webinar soon, but can you also, talk about how the people effectively graduate from your program and what your hopes are from this budget announcement?
We're fortunate in that we have a really good working relationship with our community housing provider. And so, we haven't during the pilot exited anybody into homelessness. And we offer support for up to 2 years, but we would never exit somebody because you're at the 2-year mark, of course. It just means that our wait list of some 30 odd young people, we can't move people through. And look, we do get, our public housing, the wait list is long. And it's relatively choked. So they do support us, but once again, probably community housing is our main option moving forward. Really pleased for Victoria and the support for the proponents of the Home Time campaign, and wish them well. We will continue to advocate for our young people who continue to fall through the gaps and need a level of service that is beyond what's currently available for them.
Great, thanks, Jane. And look, thank you, and thank you to Sharon. Really appreciate your time with us today, and it's given us a real insight into some of the things that are happening around the country, in Tasmania and over on the west coast, and obviously there'll be people online today who are delivering similar services in other parts of the country as well. So it's been really great to have a conversation with you about that. We're reaching the sorry, Jane. Yes. I was just
noting that there are other questions that we may not have answered. If people would like to scan the QR code behind me, that will take you through to our website, and there's a copy of the evaluation there if people would like more information.
Wonderful, thanks, Jane. Appreciate that offer. Look, so we're reaching the end of our webinar. I just, again, thank you, the three of you. Thank you, everybody who's joined us. There are just 3 quick things that I want to say before we wrap up. Firstly, when you leave the webinar today, you will be sent a survey, and we've just asked kindly that you fill that out. It's very quick, I promise, but we'd appreciate your feedback, and that will help us. We'll also send you an email to let you know when the video of the webinar is available on the AHURI website, and you're welcome to come back and look at that at any time or share that with others. And if you're interested in hearing more about future webinars and events, please look out for the AHURI news in your inbox, or sign up to that if you haven't yet. Look, thank you so much, Jane, Sharon and Catherine. And thank you to everybody who's joined us online. It's been a wonderful conversation, and we wish you all the best with the rest of your day. Goodbye.